Complete the sentence. Look at 8 opposite to help you. Children over 16, 60, children over 60s, and people with some chronic disease do not have to pay prescription charge in the UK. Parents with mobility problems may be unable to go out. They are housebound. The average JP appointment is 10 minutes long. A locum is someone who takes the place of a staff member who is on leave. Care outside working hours in now as out of hours treatment. Make word combination using a word of phrase from H box. Charge and dressing. Make appointment or make home visit. Okay. Perform minor surgery. Run a clinic. Supervise a staff and take message with member of a practice then would be responsible for each at the following. Running a clinic for pregnant woman is midwife. Teaching a parent who to strengthen his broken leg is physiotherapist. Okay. Um, Letting the GP know that a parent can't come to her appointment. Receptionist. Running a clinic for people who want to lose weight. Practice nurse. Visiting a parent who has just returned home after a hernia operation. District nurse. Carrying, carrying out and checkups on children in a poor neighborhood is health visitor. Organizing cover for an absent doctor, practice manager. Completed diary for Dr. Stewart's afternoon. Look at AMC opposite to help you. 1 at 1 to 2 p.m. Practice team meeting over sandwich lunch. Over sandwich lunch. 2 uh, 2 to 4 afternoon surgery and 12 10-minute appointment. Coffee break and 4:25 p.m. check with reception for message. Deal with home visit and repeat prescription request. Okay, and 5 to 6 p.m. paperwork, AG referrals to secondary care, admission text, telephone calls the to parent, private medical examination. At 6 at 6 p.m. phone switched OOWOH service. Okay, on 11. Okay, match these activities to the stage of medical education in the UK given in a posit. 1. Dissecting cadavers undergraduate. Keeping a log of surgical procedures observed and performed is postgraduate. Working for fa- for four working for 4 months in accident in an emergency to experience this especially is the foundation program or in talking on online course on recent development in cardiovascular disease continuum professional development. Okay? Complete the sentence. Look at B and C opposite to help you. Just before just before their final year, students have the chance to take an elective in a hospital of their choice anywhere in the world. In the world, problem-based learning contrasts with an approach where each subject is taught separately. These day lectures are often interactive with regular opportunities for the student to ask questions. 4. In clinical attachment, students learn how to treat and manage patients. 5. Student selected models can be a topic from outside medicine. 6. Dissection of cadavers is an important part of the anatomy component. The medical school at the University of Edinburgh is one of the oldest in the UK. She's consultant at the Royal, one of the leading pediatric health and specialists in the country. The Royal College of Surgeons in Edinburgh dates from 1505. We have a seminar each week where we discuss topic in a small group with our lecture. Point 3. Match each of these activities to one of the components of the undergrad course described in B and C opposite. Julie spent 6 weeks working in a small hospital in the Himalayas, overseas selective. A small group of students treats the pulmonary artery in a cadaver dissection. Otto spends a month working in the pediatric ward of the local hospital, clinical attachment, and he learns how to make blood from an elderly parent is a clinical skills. Huma chose to study travel medicine in his fourth year. A student select model. Okay.